Today we are going to discuss about the 4 common mistakes usually parents do. First, detailed diagnosis. Diagnosis is the most important part of your child's treatment. We usually do psychometric tests to confirm autism, ADHD or speech problems. But we don't go for detailed evaluation because there are a lot of factors contributing to autism, ADHD or speech delay. First we have to identify the correct reason which is contributing your child's this neurodevelopmental disorder. That's most important because most of the cases we see the parents are doing the psychometric test and they are having a gross idea of having autism of their child or ADHD in their child, and they are treating accordingly and they go to some therapy centers and doing the treatment, and usually that leads to a little bit of improvement in the child and later on the regression again comes up. But the thing is, if you do a detailed diagnosis, that will give a clear picture. Medically you will have a detailed idea of your child's contributing factors to autism. Then you can treat that condition. Then usually what we can see, the child progress very rapidly and usually they get back into the normal life and normal schooling. So I urge all the parents, please go for a detailed diagnosis, and that should be done under a medical certified expert. Next is home management, and this is the biggest part of the parental intervention because your child is going to be with you. Therapy center and to the professional they will be around 2 or 3 hours a day, but most of the time you are going to handle your child. So proper home management is very much needed, and the proper home management usually you will get when you have a detailed diagnosis. So based on real diagnosis you should go for a detailed home management protocol. So I would request you to go for a detailed evaluation and then go for a certified medical practitioner to have some home management techniques. Third is parental anxiety, stress. We understand due to lifestyle, due to work pressure, and then your child's condition is a very big contributing factor to it. But I will urge all of you to go and treat this condition of yours, because child always learn by seeing, by listening the parents. So if you are happy, the child will automatically follow you and will be a happy child. So first of all, you treat your this stressful condition or anxiety, then you can see a huge changes in your child also, and you can deal with your child very positively. Fourth is beating around the bushes. We usually see the parents wants the best for their child, but what happens usually, the parents always leads to one clinic then another and the process continues because they don't get a proper effective place of treatment and see consistent improvement in their child, and this usually leads to frustration, confusion to the parents. I would request you to understand the developmental stages of your child, then you can have a clear picture, because that this treatment is a very multidisciplinary approach. So many professionals working on a child, so there are a lot of segment and they are having their different developmental milestones. So as a parents, you have to understand, you have to learn about those milestones. Then you will get to know your child's current state as well as evaluate your child properly, and you can always measure the improvement of your child due to the level of these developmental milestones. That's why in our clinic we do a detailed medical evaluation so that we can have a clear picture of your child's condition, and then accordingly we use the treatment modalities. And that's why all the child is improving and they don't face regression, the deterioration of their symptoms. That never happens because we know the actual cause of the problem. So if you can also follow these simple steps, then you can see a lot of improvement is happening to your child's life and they are becoming independent gradually, and along with that they will gradually return to the normal schooling system. Thank you.